I know this thing is on, and I know that you can hear me. Nursing and healthcare needs advocates and activism. So what are you waiting for? Let's do the damn thing. In emergency medicine, we talk about the golden hour. And this is that critical 60-minute window where if you get antibiotics in relation to sepsis or a patient who is deemed or thought to be septic, their chance of survival is very high. Every hour after that, the morbidity and mortality rate continues to climb. What happens when that golden hour is spent waiting in an emergency department room? Sepsis is the 12th leading cause of death in Canada. It kills more people than heart attacks, and it costs our healthcare system over $1 billion a year. And yet Canada stands alone as one of the few developed nations without a national action plan to fight it. Instead, we have a postcode lottery, a patchwork of protocols where survival depends on which province you're in or even which hospital that you walk into. In February 2024, that system failed Finlay van der Werken. Despite arriving at the ER in immense pain, Finlay languished in a waiting room for 8 hours with a treatable infection which turned fatal. Today isn't just about a medical error, it's about a policy failure and how we continue to fail families who lose their loved ones to a preventable and treatable condition. Finlay's mom, Hazel, is turning her grief into a movement. We need to see Finlay's law to mandate safety nets that should have been there for her son, not one other life. Door to needle time. As nurses, we know what this means. We know with sepsis, it's not just about money, it's about tissue, organs, and life. But in Canada, we still don't have that standardized clock. We don't have a federal code sepsis. And because of that, we lost Finlay van der Werken. Finlay was just 16 when he died after waiting 8 hours for care in an Ontario emergency department. Today, his mother, Hazel, is here to tell us not what just went wrong, but how she's fighting to ensure that there is changes and that the government can make this right. We have an opportunity here to make change. Let's not miss out on the ability to see change in many people's lives. Thank you, Hazel, for taking the time to be here on the Gritty Nurse podcast today to share your story and your experience. Could you tell me a little bit about yourself and what brings you here to the Gritty Nurse podcast?
So I am a mother of 3 boys. The oldest, Finlay, is who brings me here. We lost Finlay last year to what turned out to be sepsis after over 8 hour wait in an ER. Because of him and because we lost him, are trying to fight for reform and change within the ER departments across the country.
Yeah, I believe that's absolutely necessary. And I think that, again, I just want to say I'm sorry for your loss and what happened to you. I think that it's an unimaginable situation. And I can't imagine the roller coaster that you've been dealing, all the different emotions, having to continue to talk with folks to try to make change. But even before we talk about making change, could you tell us a little bit about Finlay? What was he like as a baby? What was his personality, his passions? What made Finlay laugh?
Yeah, Finlay was full of love and kindness. And I know you always hear people say this about their kids, but he truly was. He was someone that would walk into a room with the biggest smile. Even if he didn't feel like that inside that day, he would still walk in with the biggest smile and make everybody feel just good about themselves, about life. He cared deeply for his family, for his friends. He was an animal lover for sure. He wanted to become a vet, and he embraced life. He was a hockey player. He enjoyed gaming with his friends, but he also had a serious side to him. He had a very compassionate side to him. He was very empathetic towards people and their situations, and always wanted to help, even from a very young age. He just gave 100% of himself to others. And he was also just a typical teenager who, friends and
girlfriends,
wanting to spend time with his friends. Finlay was very good at talking to people, no matter whether you were, a younger child or an older adult. He could hold a conversation with anyone. So he had a lot to give this world.
Yeah. I mean, again, I can't imagine, right? I think that he sounds like he was an amazing child. And I'm so disheartened to hear what had happened with him. And I think my job as a nurse, as a podcaster, as someone who wants to advocate for better within the system, I just hope that I can amplify your story, your experience to bring about change. We shouldn't live in a system where we walk through healthcare and people feel isolated, they feel alone, they don't feel heard, they don't feel seen. And especially in instances where there's tragedy like this, where you've lost your son, you've lost a child, where healthcare organizations should be much more empathetic, compassionate. And we're seeing that there are challenges. Like, it's hard. It shouldn't be hard to navigate, to understand, to get answers, to see an improvement in the system. I'm just frustrated for you that it has to be this difficult, because it shouldn't. It should be like, okay, what are the next steps we need to take? What are the things that we can do? How can we improve? How can we make sure this doesn't happen to another person whatsoever? And I think that healthcare has to do such a better job in saying, and really turning the lens inward, because I think people can easily find themselves removed from a situation, but it's our job as nurses, as politicians, as health leaders, as folks that are experts within the field to still show compassion. And I talk about the difference between compassion and empathy. So empathy is being able to say, I can see how that's difficult, putting yourself in one's shoes, but compassion takes it that step further. How can we alleviate the harm, the damage that has been caused? And that's what we should do as healthcare workers and as people who made a huge misstep and made an error. Because I'm not going to pull my punches. It was a misstep. It was an error. It was something that needs to be rectified. And there should be justice, whether it's national standards, whether it's policies like Finlay's law, Finlay's voice. We have to do better. What has been happening over the past couple weeks in relation to any changes or updates? I believe that there was some conversation that you might have had with like the College of Nurses of Ontario and other folks. Is there anything that you're willing to share and discuss in terms of what's been happening?
No, for sure. It's it feels like it's been busy. At the same time, it feels like everything just takes so long. There's a lot of doors that appear to open and then slowly, silently close when you turn your back. And so it's been frustrating. But we continue to speak like we are today, trying to spread awareness across the whole country. Our story and our tragedy was here in Halton, but we know for sure, we've seen the stories come in that this is a problem that is across the country.
Yeah.
Just Halton, not just Ontario, but across the whole country. But so we've been spreading that awareness. The petition has been, steadily growing for Finlay's law. We have been talking at Halton Regional Council, where they unanimously supported Finlay's law. And really by them saying that they gave their unanimous support, is that they're willing to help advocate on our behalf with government whenever they are in conversation with government. So that's great. I say that's great, but you follow up and not much is happening. And again, the frustration sets in. We also met with Minister Jones at Queen's Park to talk about Finlay's law and ask her to champion this, bring this to legislation to make it a law. She heard us. She listened, but again, it's slow. The conversation, the compassion that might be felt in that moment just disappears silently once you walk away. So we realize we've just got to keep on at this constantly. So we're waiting on an update from the Minister of Health based on what we were asking for. And unfortunately, we also had to write a letter last week to the College of Nurses of Ontario. We filed a complaint more than a year ago, 12th of November, 2024, in regards to some of the nurses who were on the night that we were in the hospital waiting.
Right.
And that process has been so frustrating. I'm using that word, but it doesn't even feel like that really explains how stressful it has been, where, you put a complaint in, and this is not a complaint for somebody was rude or, just having a moan. for the sake of it, this is a complaint because we sat in that ER and vitals were taken, showing a deterioration and nothing was done. And it resulted in the death of our child. So the most serious thing that could possibly happen when you go to an ER, when you take your child to a hospital. And what has ensued has been a year of very bad communication, not proactive. Typically, it will take about 6 months to do a thorough investigation into a complaint. And we accepted that up front because we wanted it to be thorough. We wanted them to really go into all the detail and investigate what had happened. But dates came, dates went. At the 8-month mark, we received our first kind of formal update as to what was happening. And that update was one bullet point that said, waiting on responses from nurses.
Jeez.
At 8 months after we had filed a complaint or several complaints, which resulted again in the death of our child.
Right.
And a bullet point telling us that the nurses had still not responded to the complaint to the College of Nurses. So it's the process, the communication. We have now received 2 reports back. It broke our heart because it was worse than we thought. Their own words, their own investigations, their findings, and this is more or less word for word, stated that there was a lack of knowledge, skill, and judgment, and that the members were a high risk to patient harm, that they did not understand that they saw a deterioration, but they did not understand the severity of that because they lacked pediatric knowledge.
Right.
And I can't tell you how difficult that was to hear. But at the same time, after those words and their investigation and saying, that they were a high risk to patient harm, their decision was to do nothing. That because the nurses had taken a couple of courses in the meantime, that was sufficient. It's not sufficient. So last week, we actually sent a letter to the College of Nurses of Ontario expressing how we felt,
Right.
how this experience has been for us, which has been extremely stressful, stress that was avoidable if they had kept us in regular communication, had been proactive with that, and if their process had been a little bit more
Succinct,
organized
and clear,
and succinct, and that through their process, through how they've handled this, it has been re-traumatizing for us. So yeah, it's been a hard few weeks since this has been going on. We are still waiting for one of those reports. So it's been a year and we're still waiting for the final report to come in. And it renews our commitment to having to continue to advocate for change.
Right.
It's not a witch hunt. It's never been about a witch hunt. It's about just justice. I don't even know I believe in that word anymore. On the one hand, for what has happened to us, to Finlay and to our family. And then on the other hand, Finlay's voice and the advocacy work and continuing to just hammer on and spread awareness and try to get the attention of those who really can
make change.
So we're more committed than ever.
Yeah.
To keeping this fight alive.
Yeah. And I'd like to say I'm committed as well. I think that I really want people to pause and think about the fact that communication is such a huge part of the work that we do as healthcare providers. Like that is really one of the foundations to making sure that healthcare is delivered seamlessly. To hear back from the CNO, the first report that you received that was just like a bullet point is not good communication. It's poor communication. And then knowing on the second report that they had sent back to you, where they described that, these nurses pretty much did not know what they were doing, could not recognize the severity, the decline that was happening with your son. And then nothing. And then to say, okay, well, a nurse has taken some courses. I think there needs to be so much more. There has to be so much more that we can't just say, that's all. Thank you. Have a good day. You've lost a child. This isn't, like you said, this isn't just I had a bad day. I had a rough go. And I urge the CNO to do better, to communicate better, to to really look at this from a trauma-informed lens, because waiting 8 months is horrendous. And I don't want to hear the excuses of the pressures of the system, because they're quite removed, right? They're not working actively in a hospital, so they can't just say, oh, we're short-staffed.
Yep.
There's got to be a better answer, better resolution. And how do we get the pressure for these nurses to actually come to the table and to respond to this? I think that's another question that even I have, and I'm going to do my due diligence to find out why is that. I'm going to assume that they're probably unionized. There might be some union issues related to that, but at least that could be communicated,
Yep.
right? They could tell you that here's what is slowing down the process. But just bringing it back to the fact that, again, I'm not a proponent of someone to criminalize, but at the end of the day, there has to be something more. It can't just be, well, they did a learning module, they did their e-learning, because we know that education is literally the lowest rung for someone to continue to improve practice or care. And policy change is right at the top. So how do we automate the fact that, they missed the fact that your son was declining?
No, they did not miss the fact. That was the thing that drove another dagger through our heart. That in one of the comments, it stated that the member, in quotation marks, did a good assessment because they recognized the deterioration, but because they had more experience with adult patients, they did not recognize the urgency and severity.
Well, then that almost makes it worse, right?
Yeah.
That the fact that we have escalation policies in the hospital to escalate care when you see that you might need additional support. And again, one of the things that when I worked in Emerge Peds and I was an educator, we had checklists, right? We have competency checklists that we say, okay, here are the competencies that you as an ED nurse needs to have. And we did emergencies. We talked about pediatric emergencies. We talked about recognizing a deteriorating pediatric patient, because we know they compensate so well and then they crash. And the thing is, the fact that it was recognized and there was no escalation, to me, again, is a fail-safe. There has to be mechanisms put in place, and an e-module is not good enough. Taking a course is not good enough. The organization needs to hold accountability to show that what are the policy changes that are being made. And again, I am frustrated for you that was the end result. Have you received any word of an apology from these nurses?
No. I mean, of course, we have also the lawsuit which continues on, but no, there's nothing. And I understand also that, I mean, again, this is not a witch hunt. This is
right.
Not going just for individuals, but the hospital has to answer also. We know that there was staff shortage that night now through the investigation. And there has to be ways where if you're down, that you can somehow get another person to come in and replace.
Right.
So I get it that there's shortages, that there's not enough funding, that the bed flow, the bed block as they call it, where people can't move through the system, and that increases ER wait times. I get all of these things, but none of it is new. None of it is something that's just started happening. And that's where our anger, our frustration, our drive comes from, is that people have been advocating for so many years, decades, and yet we're still here and we're still in this position. And my son died when it didn't have to.
I agree. And I think this is where, again, urging the CNO to do more, because we can't have a system where we don't punish people. I'm sorry. I know that sounds really harsh. And I know you said that it's not a witch hunt, but there has to be a system in which we recognize if the person isn't competent and they're at a risk to do this again because they aren't learning, they don't have that educational foundation, then maybe they're not in the right place to be in that position, to be in that job, to be in that role. And we've seen it, for example, even just this week, I was talking about the maternal morbidity crisis, and there was a nurse who was very nonchalant, just not even caring about what was happening. And I'm not saying that the situations are exactly the same. But when we see this type of action, we do have to take greater action than just an e-module. I believe maybe this nurse does need to lose her job. I know that sounds harsh, but I think that there's things that has to be done. We can't just say, here's another e-learning. If it has been shown that they had the tools and the resources and they didn't act in accordance to the policies that outline our practice, then what are we really doing? What are we really doing? And I think that, again, this is why we have to drive policy. We have to automate things, and that we want to make sure that this never happens to anybody else ever again. Like you said, it's not a witch hunt, but we do demand accountability and change. And I'm sorry that you don't even feel that the word justice is something that is even a part of this right now.
In all of this, in every step that we take further, whether it's the lawsuit, whether it's the complaint process, whether it's the advocacy, there's one thing that is lacking in everything. Every new piece of information that we learn is that there are no consequences.
That's not right.
There's no accountability. And that has to change, because you can't reform. You can't get better. You can't make changes. You can't look to the future if there is no accountability, if there's no consequences, whether it's consequences of, we create these standards.
Yeah.
The standards that we do create, and there's even reporting on them, but there's no consequences if you don't meet them. In regards to the triage levels and the guidelines they give, if there's never any consequences, then there's never any drive or need for organizations and medical associations to do better.
Yeah, no, I completely agree with you. And this is why I'm even saying that there are so many cases in which we see this where, the nurse needs to lose her license. She doesn't need to be working. If she's not safe and fit to practice, then what are we doing? Why would we allow this to continue? And you're right. In healthcare, accountability is such a difficult thing. You don't know who to ask. You don't know the next person to speak to. They make the process very difficult and cumbersome to navigate. And it should not be like this whatsoever. And like you mentioned, we aren't talking about it was just a minor incident. Oh, maybe it was a mismedication. We are talking about someone's life. Your child had died. So we have to take this much more serious, because we don't want one other. And we keep seeing sepsis in the news. We keep seeing these instances. So at what point in time are we going to have this call to action? I think it's now. I think it's now that we have to say we must do better. And this is where we need to urge our politicians, the people in power who can make changes, to all mobilize support to say, you know what, not one other life, not one other individual should ever go through this. If there's any way that I can continue to mobilize and amplify and talk to various different people, I will, because at the end of the day, this should have never happened. Never. And you should have Finlay here. And it's frustrating that they're not making this easy.
No.
And I will do what I can.
Up.
No, we won't. We won't, because we have to ask for accountability. Like, we have to do this. And I'm willing to do this with you. We'll do it together. So we've talked about Finlay's Law. Is there anything else that we haven't touched on that you'd like to touch on today?
I think when you asked us what updates we had, one of the updates, because we've been talking a lot about ER wait times and, how you can reduce that, and the fact that it's just too long. But the other side of our story is, as you mentioned, is the sepsis side.
Right.
So we haven't been saying a lot on that yet, because there was enough other things to be fighting.
Right.
But we're starting to now collaborate with others, with Sepsis Canada, with another group who's putting together a national action plan in order to bring awareness, to bring education to sepsis, because it is one of the top killers of people who end up dying in our healthcare. And there's not enough known about it. There are no national standards in Canada. So there are groups working on that, and it's great. But again, that's another thing that needs to happen, is we need to be aware, because there is such a short window with when somebody has sepsis, in order for them to get care, to be able to kind of hit it on the head before it becomes organ failure and death. So we're starting to ramp that up. We're starting to have those conversations, and we'll start to share more about sepsis and bring awareness to it.
Yeah. So Hazel, I know that you're doing this work in relation to Finlay's Voice, which is incredibly powerful. Could you tell us a little bit more about the work that's being done? And again, I think this is where healthcare providers can be a part of this movement to also, understand what's happening and be a part of how we can create change.
Yeah, no, absolutely. I think, to be honest, the only way this works is if everybody comes together to find solutions. So We are focusing on pediatric care and specifically around emergency departments. And not only for Ontario, our plan is that the whole of Canada needs to sit up and listen and make changes. But right now we're focusing on the Ontario government and trying to petition them to enact what we're calling Finlay's Law, which is, I think, only a small part of what really needs to be done, but an important part that will, I think, that is something that is tangible, that can be hopefully put into place very quickly.
Right.
We're trying to, not start with the whole mountain, but just what can effect change very quickly.
Right.
So we have a petition for Finlay's Law, in which we ask for a number of different things. So we talk about ER wait times, which everybody knows.
Yeah, it's a chronic problem.
Yes, it's awful. We've known it for so long, and yet nothing ever changes. It just seems to get worse. It's not a pandemic problem anymore.
Yeah, I agree.
The pandemic, for sure, probably amplified and exacerbated the issue, but this has been going on for a long time. So we're looking to for pediatric patients to put in some wait time limits so that they're seen faster.
Right.
Kids are not little adults. They're different. They have different needs, and they're much more vulnerable as a sector. Even 16-year-olds.
Right.
They require to be seen quickly when there is something severe. So we're asking for some actual limits to be put in place.
Right.
What that looks like right now, I don't know. Those are conversations that need to be had, but there needs to be some restriction around how long can a kid sit there in ER.
Right.
In particular with high severity triage levels.
Right.
We're also tackling the fact that, again, something that is known widely, that the nurse to patient ratios are not
too
great.
high. Yeah.
And the doctor to patient ratios, both of them are way too high, and those have to be looked at. We need to be starting to set some standards there about what is acceptable, what is going to change. We're also asking for some independent auditing of hospitals. So if we have compliance, if we set wait time limits, that somebody's actually going in and checking that things are being done to meet those standards. Finlay was triaged as CTAS level 2, which is emergent and at risk of deterioration very quickly.
Right.
Just to put perspective, level 1 is you need to be resuscitated.
It's life or limb, yeah.
Yeah. And in those guidelines, it's saying that you should be seeing a physician. If you're given this CTAS level, you should be seeing a physician within 15 minutes.
Right.
Finlay was 8 hours and 22 minutes.
Yeah.
And I know there's reporting. I know there's reporting that happens, but reporting is useless if nothing is done with the data that comes in that's telling us that our gap is so big that it is ending in tragedy in our case. So there needs to be somebody who is governing and auditing that compliance. And then on top of that, we are calling for any child death in ER to be mandatory coronary inquest. Right now, we're waiting any day for the decision on whether they will grant us that inquest. Our point of view, and many who are helping us on this, is that every child who dies in the ER should be given a coroner's inquest. Right now, that is given to any prisoner who dies.
Huh. Okay.
That is mandatory, but there is nothing set
for pediatric patients. Yeah, no, I think, again, a lot of the things that you mentioned are hugely important. Again, I had the opportunity to oversee some pediatric emergency services, and I can tell you that, one, they do get training. Two, that there needs to be standards. I can tell you, so there's this thing that we have that we call accreditation, where we have various different people who come into the hospital settings to essentially make sure that, certain processes are followed. And I would say that organizations do, particularly hospitals, do a really poor job. They get accredited, but the work that goes into is piecemeal. They rush. A lot of the things that are done, they're checking boxes, but the efficiencies and the processes of what you're asking for aren't done and aren't up to standard. One of the things that I had been doing some research in, which I think is going to be important for you, is there are no national standards in relation to sepsis. Nothing, which was surprising for me. So it just makes it begs the question to say, what are we actually doing here if we don't have standard set processes? And understanding that pediatric patients do decline quicker. Why don't we have something set in place? Because sepsis is treatable. It's preventable. And again, there's work that needs to be done here. So I think that although the situation is horrible, it should have never come to the fact that someone had to lose their life for changes to be made. Healthcare, unfortunately, is very reactionary. We're not very good at prevention and proactive, but I really hope that with Finlay's voice, that we can push for accountability, because there isn't enough accountability. And I think you're right. The things that you mentioned aren't things that are in place right now. We should have better triaging for pediatric patients. Finlay should have never waited 8 hours. As a CTAS too. I can tell you as a nurse, that is insane that happened. Well,
I think to that point in particular, I think the triage level that we went in with was the right level for Finlay. So that was recognized.
Right.
But what needs to happen, especially for somebody at that level, is that they are continually triaged.
Right.
And that is what is lacking.
Yeah. And you mentioned the fact that staffing. So if Finlay was supposed to be checked on every 15 minutes, well, why didn't it happen? And I don't want to use that as an excuse, because one of the things that I always talk about too is we're chronically underfunded, understaffed. I had shared with you even the fact that there are instances where organizations have to cut nurses. Nurses are always the first ones that are cut in relation to, trying to balance the budget, but we can't balance the budget off of anybody's life or expense. And I think we do need better ratios. And I think there was one physician on that was working that night, or what was there?
It was,
because I think you mentioned something about staffing levels for physicians.
There was a few that were on when we went in, but at one point they were down to one, and then I'm sure actually at some point it felt like there was 0 doctors in there. Nobody was called forward for over 3 hours. Yeah, that's there. And this is where, again, I would continue to say that there are definitely fails here. There is an escalation procedure at organizations where if you are feeling that your concern is not being taken seriously, or you feel that the patient is sicker, that you have a chain of escalation. They can escalate almost right up to the CEO if they need to. Like, nurses have that policy right there on Epic or whatever system that they're using. They could pull up, okay, I can't get a hold of this doctor. Who's the next person in line? Who's the next person? So those things are in place, and it begs the question as to why escalations weren't made. And I think this is why we have to have this conversation to say this should never happen ever again. No. And again, I think we have to do a better job in terms of just saying, I'm sorry. I think that's probably one thing organizations don't do very well. We can't just be an apology. There has to be action with it. And I hope that there will be action taken. What would you say is the most critical change that you want to see coming out of Finlay's voice? And how do you think this is now kind of almost a loaded question, but how do you think that might change the face of healthcare if we enact something like this? I think, well, with Finlay's law and what we currently have there, I think it's a start, and that's why we're pushing for that right now. But there's way more to do. I mean, you brought up the sepsis awareness and care. It is extremely poor in terms of what the knowledge is out there, and what care needs to happen. In particular, because as you said also, the pediatric patients react differently. You don't see the same signals that you would with an adult. And so that's a big education piece. So our first goal is, let's get Finlay's law as it is, but understanding that that really is just the first small start that can make a difference. And we understand that this, ER wait times needs to be righted for everybody, not just kids, but we're starting out there.
Yeah.
So if we can get the ball rolling, and we, in Ontario can get this law put into place and these changes administered and enacted, then we can roll that out. And then in the meantime, we can start looking at all these other things. There's a lot of places, even within Canada, that are doing great work on sepsis awareness and care. Nova Scotia have been running pilots. BC have done quite a lot of work. Outside of Canada, there's also been amazing work done. We don't need to keep reinventing the wheel. We just need to put in place what needs to be put in place to protect the patients.
Yeah, no, I agree. And I think, like I said, healthcare tends to be very reactive. And I think this is a moment where we need to do better. We need to step up. And I think there are a lot of key players in terms of who we should be knocking on doors. Like, I think here's my call to, like nurses, administrators, anybody who's listening. One, yes, sign the petition so you're a part of the change, but also start having conversations, right? These are things that we could huddle on. These are things that we can say, what are the standards in our organization, and really not to silo the work. I hate to ever say that the US actually has some better stuff. They actually have better standards on sepsis than we do here in Canada. And I think that is just, we have a lot of work to do, and we can't wait. We have to act. So it's like, hello, Doug Ford. You talked about wait times. He literally campaigned on ending hallway medicine. That was one of the promises that Doug Ford has made. And we have to hold our political leaders accountable as well. So what is Doug Ford doing in relation to healthcare and ending hallway medicine? What are, various different societies related to pediatrics? Pediatric Society of Canada, what are they doing in relation to sepsis? Again, knocking on some of our administrators' doors. This is probably not an isolated incident. Probably has happened somewhere else. How do we collectively, as hospitals across Canada, have this conversation? I'm going to be putting my finger in people's chests to say, okay, we've got to do better. And is there any other things that you think that we can do to build awareness? My mind goes to, I don't know if you've had an opportunity to have a press release or media release, but maybe it's about time to stand in front of with the mayor and bring more media attention to the fact that this needs to change.
Yep. No, we've done a lot of work with the media. The media actually they've been good, amazing, and we continue to be in touch with them. So they have spread awareness of what we're doing and the situation. And that has been fantastic, but we need to keep that up.
Yeah.
The next story comes along and takes everybody's attention. And from our perspective, I think one of the biggest things that we can do with everybody's help, with Finlay's Voice, is make sure that it's not kept out of the news, that we keep it up, that we keep on. We've the mayor of Burlington, Marion Mead Ward, and her whole team have been amazing, advocating with us. We actually, I went to Halton Regional Council last month and spoke there, and they unanimously passed a motion supporting Finlay's law, and also in particular for Halton, the request that, it's a growing community. There needs to be a pediatric hospital, ER wing, something where parents can take their children when there's an emergency, because right now, everybody is either going to Toronto Sick Kids or McMaster Sick Kids, and they're being flooded outside their areas. And you have to remember that when something serious is happening, you're not getting in your car and driving further away than necessary. You're getting there as quickly as you can. And to that point, you know, I think the statistic is something like 85% of pediatric patients going to emergency services are going to general hospitals. And that's one other thing, the point that we have under Finlay's law is there needs to be better pediatric readiness in the ER in general hospitals.
Yeah.
They need to be ready. They need to understand what it looks like when it's a child, when it's sepsis or when it's deterioration in any way, to be able to do the job and to do the job that they're there for, which is take care of the patients and to bring them back to health, not to watch them die.
Yeah. I think you're 100% right. And I think this is where, again, we have to compel our leaders to do something. And I would tell you, emergency departments, from my understanding and just from the little knowledge that I have, because I actually worked in quality improvement in the emergency department over at Niagara, is that pediatrics tends to be a scary place for learners, but it's not an excuse to not have that knowledge. And maybe there needs to be a greater focus on pediatrics in terms of emergencies, and really set some standards around how we go about caring for patients. And I think maybe the ratio should change. Maybe if you're working in the ED and you have a pediatric patient, maybe it is 1-to-1 if they're a CTAS too. You know, maybe these are some of the things that we could look at to say, how do we make the system better? Because we don't want to see what happened. And again, I think it's important that we all do some work. And you're right, news cycles change very quickly, and we need to be able to, one, keep the story so people can continue to keep their eyes and focus their attention on saying that, you know what, this is going to happen again. We need to do better. And I really hope that we can do better, because I'll keep putting my finger in people's chests. I'll keep talking about this until we see change, because I couldn't imagine being in your position. And I'm very thankful that you're here. And if I could help create change and help other nurses say, and use their voice, their platform to elevate and amplify the story, I will as well. It has been an incredibly difficult conversation, and I really appreciate your willingness to be here and share Finlay's voice with me. Is there anything that we haven't touched on that you'd like to share, or any message that you'd like to leave with the folks that are listening today?
Oh my goodness, there's so many. I could still talk for a while, but a couple of things. So education, many of the things that were touched on today are around the education of nurses and staff in hospitals to be able to recognize when there's deterioration and recognize what those differences are for pediatric patients. There's education for us as parents, also about understanding when something is an emergency and not going and filling up those emergency rooms. And I know it's difficult. I know that people are without doctors, but we all have to do better. Yeah. And as I started at the beginning, where I said that, each and every one of us has a responsibility to make sure that things change. And I don't think it's a case of, I hope that things improve. It has to.
Yeah.
We're beyond the point. We cannot continue, or there will be more deaths. And from myself and for my family, we just don't accept that. We don't accept. So we are meeting with Sylvia Jones, Minister of Health, on Thursday, this coming Thursday, to talk about Finlay's law, to talk about all of this, and to ask for her to stand up and bring this legislation to fruition. Yeah. And my hope is that she can do that, and she will do that for us. But we're still asking for every single Canadian to stand behind us, to stand behind Finlay's voice, to sign the petition. It's great. I mean, we have, I think it's over 28,500 people who have signed, which is amazing, but we need to make such a loud noise. And we do that by signing this petition and saying that, you know, we're not okay anymore. It's not okay that we sit back and we just understand that there's problems and do nothing about it. So my call would be to everybody to go to change.org and look for the petition, or go to finlaysvoice.com and you can find a link to the petition there. We need everybody's voice to join Finlay's.
And I'm gonna share that too. I think you know, maybe before you leave, maybe we could do a little TikTok and just say, hey, we need more signatures. We need more awareness. We need more people who can use their power. That's the other piece, right? There are people in power out there that can do something.
Yes.
And we need people who are in those positions of power to make changes. So, you know, maybe I'll tag we have a new federal minister of health as well. Just seeing what we can do. Because I believe that, you know, there are something like 400,000 nurses in all of Canada. And the change that if we all stood up and said, this needs to be different, we could make such a powerful impact. And I think that's important to your family, and it will be important to many other families, that no child who ever comes to the emergency department ever has to be misdiagnosed, not looked over of something like sepsis, which is preventable and which could have had such a different outcome. So we're going to do the work. I'm here standing in solidarity with you. Whatever I can do, I'll make sure that I put it to my listeners as well to say, hey, here's some work that we can all do, pulling up our sleeves to help support, and just also be a voice, right? It's Finlay's voice, Finlay's law, and we need to be all on board to make changes for Finlay and for any other pediatric patient that comes to the emergency department. I've got little ones too, and I think that safety is such a huge priority, and I wish that we could have done something different. But we can't go back, but we can move forward and we can make change. And I think that if there's any way I could help support, I am here standing in your corner, because we do need to see much more change. And again, thank you so much for coming here on the Gritty Nurse podcast to share your story with me. If you ever want to come back, because there's more, you are more than welcome to come back. Hopefully my studio will be working the way that it's supposed to be working. It was giving me grief. But again, just that I stand in solidarity with you. And if there's anything that I can continue to do, that I will, and that we're going to make change. I think that's my commitment to you. I'm a little bit of a pit bull when it comes to some of this stuff. And if we need to poke our fingers in certain people's chests to make change, please, then we're going to do it. We're here to do that. So again, thank you so much for sharing your story with me, for sharing Finlay with me. And again, we're going to make change. That's the goal.
Yeah, it is. Thank you.
We're not taking no for an answer. It's all about accountability. Thank you so much. Looking for a great gift for a nurse or someone who needs to learn about nursing? Check out my national best-selling book, The Wisdom of Nurses, Stories of Grit from the Bedside. Thank you so much for listening to The Gritty Nurse with Amie Archibald-Varley. If you're watching on YouTube or listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, please hit the subscribe button so you'll never miss out on any awesome episodes from The Gritty Nurse. Thank you so much, and stay tuned until next time. Stay gritty.